So our lecturer for January is Dr. Isobel Walker. Dr. Walker is a foundation year 1 doctor, having studied medicine at the University of Nottingham. While at university, she worked alongside their outreach team to help widen access to medicine. And she's also a keen artist, having rediscovered this passion during the COVID lockdowns as well. So with that, I will hand over to you, Dr. Walker.
So yes, my name is Izzy. I am a foundation year 1 doctor, which means I've just finished medical school, which is in the same time terrifying and great. And as Zach said, I went to Nottingham for medical school. So I come from London and went to Nottingham. So I moved north about 120 miles. So I wanted to get away from home, and it was one of the best things I ever made because it really helped with my independence and getting a different taste of life. And I'm still up in Nottingham now. I could have moved back, but I didn't, and I finally managed to get the slides up. So without further ado, hopefully you can see that. So
yeah, that looks good to us.
Thank you. So I'm doing this presentation on breaking barriers because, as you probably know, there are a lot of barriers in medicine and at medical school in particular. As I've been through medical school, I'm going to focus particularly on medical school because I'm very junior to medicine, and I don't think I am particularly qualified to say what they are in medicine yet, because I'm still finding them out for myself. If you don't know, this is the Berlin Wall on the day it fell down, which I think is one of the biggest breaking of a barrier in history. And I think it was quite an appropriate picture to put in this. So there we go. So a little bit more about me. I went to University of Nottingham. I have 2 degrees. So I have a medical degree and a BMed Sci. Nottingham is a unique course. I'm doing the classic Nottingham widening participation thing now, but we do 2 degrees in 5 years. The first 2.5 years it's BMed Sci, second 2 years it's a medical degree. So I didn't intercalate. I didn't want to intercalate. Nottingham was a good way to get 2 degrees because I wanted those. So I'm now an F1, which is code for very, very junior doctor. Basically go around with warning tape all over me in stroke medicine. My first placement was in A&E. I do a lot of art and I do a lot of writing. And my next thing, once I finish my foundation years, is I'd really love to do a master's in medical education. So that's my plans for the next few years. I have no idea what I want to do in the future. That's me on graduation day. It was sunny, which was lovely. And that's one of my favourite places on campus in Nottingham. And that is who gave our degrees to us. And if any of you recognise him, that's JVT, as in Jonathan Van Tam, who was always in the COVID briefings talking about football teams, football clubs. And that was really cool because he's now the Vice Chancellor of Medicine at Nottingham. So that's my little fun fact about Nottingham there, and that I got a degree from a cool person. So working in the NHS at the moment, I've used my favourite sport, F1. It's chaos. I also applied when working in the NHS was chaos, so I know what it feels like. I applied during the 2016 junior doctor strikes. As you might know, in 5 days' time, junior doctors are balloting again for strikes over pay. So it is a very difficult time in the NHS, but I don't know any different and I still kind of love it. So if you want to do medicine and you want to do it for the love of the job, I would not say don't do it. If you want to do it for money, I say maybe reconsider. But if it's for the love of the job, for generally wanting to do that job where you're going around applying science, applying biology, and getting to do these really cool things, Like yesterday I was in a neurosurgery. I'd say do it. It's amazing. So some examples of barriers in medicine. I'm sure you'll know quite a few of these. I have just come up with some. So there's the sorry, Alexa just went off. So there's the postcode lottery. And by that, I mean where you live. So what school you went to, what sort of things are available to you in your region. So what schools could you have gone to? Could you go and do lots of extracurricular things? There's all of that come into the postcode lottery. There's what language you speak. That's going to be a big barrier, because if English isn't your first language, and you struggle with English, that might become a bit of a problem when you go to English language lectures and you don't understand what's happening fully. Race and culture, that's a big and prominent one at the moment. And if there aren't mentors or advisors who are from your race or your culture in your medical school, or there's not a reverse mentoring scheme or anything that makes people understand that not everyone goes through the same experience at medical school, then it's not an inclusive medical school. And especially when you come to somewhere like Nottingham, for instance, I can't talk for Brighton and Sussex, but especially when you come to somewhere like Nottingham, a lot of our patients are not white Caucasian, and they're not white British, and you're not going to be treating people from the same background as you in a day, every day. And so you need to be able to understand diversity in a big way. Mental health, big one. And that's what we're going to be talking about later. Physical health, same as mental health, big one. If your physical health is affecting you, it can really present a barrier, because if you're unwell and you can't go to lectures, or you get hurt and you take time out, and then you find that you miss a big chunk of time for your exams, it could affect your exams. A lot of these are just like sixth form. You can see why they might affect it. Parental income, that's a massive one, especially when you come to uni, because you live on a budget at uni. And if some people get extra money to live on, when they can spend it on textbooks, on resources, then, well, that's a bit more money that makes their life a little bit easier when it comes to exams. Of course, there are bursaries, but a bursary is a limited amount of money. It's finite, and you'll see that this does make a difference. I'd say that it's less of a difference when I started uni back in 2017, because people are aware of it now and aware that there are these differences, and that they try to make it easier for people who have a lower parental income. Similarly, no previous family members in the medical field. If you have lived around medics, and you have let's say your dad is a consultant in, emergency medicine, and he's able to teach you all the things you need to know as a tutor, that's going to really help you. As opposed to, say, my dad, he is not, no, he faints if he even thinks of blood. It's really embarrassing. So that means that he's not going to be able to help me with my questions if I don't understand something. And imposter syndrome, that comes under a lot of those above. I just think it's a big thing. It's not something to be ignored, and it doesn't really go away. It's normal. You'll always have it. And I think it's really important to realize that imposter syndrome is basically you doing the right thing. Because if you don't have it, I sometimes think, why don't you have it? Are you being overconfident? And are you more likely to make a mistake? So, as I said, mental health, focusing on that. There's a charity in Nottingham called Not Alone. And I just want you to consider how these next slides make you feel. So basically, I'm thinking, what thoughts do they evoke? And would you say you've ever unknowingly stereotyped like this? Medics, especially in medical school, can do this because you don't know about these conditions and you don't quite understand them. I've definitely heard it in the doctor's office. In the 5 months I've been a doctor, I've heard almost all of these. And I just want you to think about them a little bit. So I'm just going to run through them. So there's a few of them there which might have made you think. Some of them you might have thought, no, I know that. And some of them you might have thought, actually, that does give some food for thought. Even if you did know it, you might have thought, actually, that's a good way of putting it. If you'd ever want to explain something to a patient or explain something to someone who just doesn't get it. And all of those conditions and not being able to explain something can present barriers. And I like this one in particular for myself, is what is normal anyway? Which I think is important to consider really, because there isn't a defined normal in any respect. So I'm just going to ask you a couple of questions, which is, what is the normal amount of anxiety for a sixth form student? Because I'd say that it's January now. I'd say that some of you, if you might be feeling that your anxiety is maybe at a 5 out of 10. No, it's not the worst it's been, but it's not great. Some of you might have mock exams coming up. It's pretty high then. It's maybe 7, 8, maybe. It's getting up there. Some of you might just be thinking, no, it's fine. It's 2, 1 even, maybe. It's not bothering you. But if I said it was May and you're in year 13, that would put you just doing your A-levels. I'd put my bets on, if you want to do medicine, you are stressing. Most of you would be at an 8 or a 9 or even a 10. There is a big difference between a 1 and a 10 on this scale. And it is normal for you to vary. But there is no normal amount of anxiety because it varies by person, it varies by place, it varies by time. And I think it's true to say that having that perspective on if you're feeling really rubbish one day and you're just feeling, nope, don't want to go in, I'm just too overwhelmed, thinking, you know what, for me, this could be normal. It doesn't mean I failed in anything. For me, this might be normal. It does kind of help a little bit because it's not like you've strayed from the normal of a standard student, because there isn't one. It fluctuates. And then there's another one, which is, do you talk to your friends about mental health? And when I asked a group of girls from my old school this, they were all in year 12. They were all like, yeah, we do. Yeah, what are you talking about? I can say to you, absolutely, hands down, when I was in year 12, so lower sixth, that was a big no. No. You did not talk to your friends. This would have been 2015, 16. And that's a good change. That is a really good change. So for you, it's quite normal, but for me, it is still very abnormal. It is not a natural thing for me to do, to talk to my friends about mental health. And it might change because I can't say that because that group of girls talked to their friends, I can't say that you definitely talk to your friends. But for me, yeah, not normal. However, I'm expected to go to a random patient I have never met and talk to them at great depths about their mental health. That is really, really, that's hard for me. It's hard for the patient as well, obviously. It's probably harder for the patient, but it's not natural for me because I want to go, no, this is really weird. And through medical school, they say, oh yeah, well-being. You need to talk to people about things. And everyone just sort of does this no, sort of, why would we do that? Sort of feeling. And there is that sort of feeling in medical school that you can't be unwell, you can't be ill, especially having mental health problems. And we'll get onto that in a bit. But I still struggle to do this. And starting earlier in talking to your friends, even just saying, I think there was a Walker's Crisps advert over Christmas, which is asking, how are you twice? They didn't just do it oh, how are you? And then he said, oh, fine. How are you? As if you're being just annoying, but saying, I think they said, oh, how are you, mate? And then he said, oh, I'm okay, yeah. And then his friend said, oh, you can't be okay if you're wearing that jumper. How are you really? And it's so it's kind of a friendly way. I think there are ways to do it to actually get into someone. But just to drill in how different people are in terms of what is normal. This is very normal for me. And I didn't realize how abnormal it was until I showed it to my sister and she was like, I have no idea what that means. She could work out one of them, which was 34 male. So if you can work out any of that, it's I mean, this is what I'd normally get when I was working in ED. We'd normally get this sort of thing as like a triage. So the ambulance would hand this over and it'd come up on our screens. And that's what we'd get as a, this is what the patient you're about to see, this is what they presented with. But what this means is, and you'd get taught this through medical school, by the way, it would just naturally happen and you realize you've learned it by accident. That's the annoying thing medical school does to you. You learn things by accident. So it means 34 male, insulin dependent diabetes mellitus, brought in by ambulance, possible loss of consciousness, a lot of nausea and vomiting. His blood glucose was 27, might have drunk too much alcohol, possibly diabetes mellitus. No, not that. Possible diabetes, diabetic ketoacidosis. And when I put it in like plain English like that, it makes a bit more sense. So that's normal to you, normal to me, very different. So, but if someone had written it all out like that, I'd think, why are they doing that? So it changes. But most of the time I just feel like this at work. Because of that, as I said, does not feel natural for me to give mental health advice. My mental health is normally more like that. I mean, I've recently just been signed off sick for 2 weeks, just come back to work actually. Back into the NHS crisis, which was fun. And this, you find posters around this, like this, around the hospital, in doctors' offices, which are interesting because we know this deep down, but we need to be reminded of it. And you'll see it around medical schools as well, because it is just as relevant. I think the stats are that 1 in 3 medical students said that they had clinical levels of anxiety around exams. And that's not just anxiety around exams, that's clinical levels of anxiety. And that's not to put you off, but that's just to show how much people care about what they're doing. The same care you give to others is saying, you really care about this job, but remember to care for yourself as well. And if I showed the next picture to a room full of doctors, we would all be in tears. I don't know what effect you guys would have. This is just, no. And what happens to, this is Fruity, if you don't know. She's from This Is Going to Hurt, which is an excellent book by Adam Kay. If you haven't read it, read it, it's hilarious. I have some stories already like that. Obviously I couldn't write as well as, I love writing, but I could never write as well as him. But it got changed into a BBC TV drama, and they added in this character called Shruti, who is an F2, so she would be the year above me. And she's working obviously in gynae, and she's struggling with the way that people are treating her and the amount of the job load and the way her parents' expectations. And I don't think that her seniors were very supportive of her, and ultimately she dies. And it is one of the most devastating scenes ever. And it struck a chord in medical communities, to say the least. And it does happen. It does happen. And it happens too often. But with this sudden awareness of mental health conditions that is starting to begin to happen, there's beginning to be more support. This is post-COVID, I think. I've noticed in medical schools, post-COVID, I think people become more, oh, okay, well-being is really actually something that needs to happen, because suddenly our students are needing to have a bit more pastoral support, a bit more time, and they're not getting it. And so let's focus on that. And I think that it is beginning to happen. And there probably isn't any measurable effect yet, but it'd be interesting to see what the rates are pre and post COVID pandemic, and pre and post any wellbeing initiatives that are put in place. There's practitioner health, which is excellent, which is a NHS, like funded by the NHS service nationwide, like a GP only for doctors, which means it's confidential. And that's just for mental health conditions. So it means that you're not going to run into a colleague that you know. And I'm back to this. I spoke about these two. So I have depression, I have anxiety, I have a few more things. I take a nice lot of medications every day to deal with this. And, it started off as just one tablet, and it's ended up as quite a few. This isn't all of them, this is just evening. So those are antidepressants. That one's an anxiolytic. That's another anxiolytic. That one, I don't quite know why I take it. I think it's a mood stabilizer, possibly. Could be an adjunct to the antidepressant. And that's an antihistamine, which is used for sleep, because it's a drowsy antihistamine. Works really well. But, you don't, sometimes I think people don't expect doctors to be ill. Doctors are invincible, doctors are, they don't get ill, like, who'd heard of that? And the same applies to medical students as well. People expect them to be ill a bit more, but medical students themselves don't allow themselves to be ill. I didn't. I was very rarely took time off in medical school. And I learned to regret that one, because your body needs a break and your brain needs a break, and you get unwell if you don't give yourself a break. You might have noticed the jump from GCSEs to A-level, the level of independence you have in managing your own time. Again, from A-levels to uni, so you have another jump in managing your independence, managing your own time. And I'm not going to say there's a jump in everything. Everything's a jump, because I don't think that's true. There's a lot of jumps, but I think that academically they follow on, and I don't think you need to worry about that one. But and that was a general consensus for my whole year. That's just not me. That's not just me. Don't worry. But there is jumps in terms of a new environment, a new set of friends, and all that, and that's enough for people to be getting on with, as opposed to for their brain to have to deal with not understanding biology because it's just stepped up a gear. No, don't worry about that one. And we're back to what is normal anyway. That seems to be a slide I just put in there because I like the picture. I'm now going to talk to you about a few things I learned the hard way at medical school. So things I didn't do. And so they're lessons that I'm going to teach you, so you do them. because these will make a big difference to your life when you go through medical school, university. Even if you don't end up going to medical school, if you think, you know what, no, don't want to do that, because people do make that choice, and that's totally fine. I have a friend who was in my first year at medical school and has now got a degree in French and Spanish and is working in Spain. So, you know, people make different choices, and she is really, really happy. So, first one is talking about it truthfully. So I'm having to tell a friend to do this at the moment. She's not taking it very well, because she doesn't really want to. But going slowly, just, you know, being able just to go for a walk and, you know, not have a time limit on it, or ask a friend to tell staff members, anyone you trust. Doesn't have to be a medical school faculty member, doesn't have to be your sixth form tutor. It could be, you know, someone else you trust. You could ask them to say, hey, can you, if I tell you this, can you tell the PE teacher? Because then that PE teacher will get in contact with you and you'll know to expect it. In a similar way, write it out. If you write it out and you can see what the most pertinent points are, what you actually need to say. So rather than blurting out your entire life story, which does sometimes feel relevant, but sometimes you just need to say, look, this has happened. I feel like this. Please, can you help with this? Emailing it as well. If you want to, if you're like me and do not like talking about this sort of thing face to face with people, then for the first time, once I've done it a few times, I'm okay. And I get annoyingly okay with it because I just appear in front of people and like, hello, I'm back to talk again. But emailing it does become a good idea, because you write it out, send it, and you know it's sent. You can't change that. They will see it and they will reply, normally via email. And it means that it's sent, it's told, it's said, and it's done. And warning shots. So you can ask to meet someone and say, I need to talk about X. Let's say X is the way I'm feeling, or I'm not feeling great. And then they know what to expect in a meeting. I put truthfully there for a reason. I left out a lot of stuff, and that didn't help me, because the stuff I left out were the stuff that was most concerning me. It's not moving on the slide again. There we go. Let yourself be helped. Apparently, I went into metaphor mode here, which is brave faces aren't always the best idea. They're not, because they won't stay brave for long. It's this sort of thing, you can bottle things up and then it just explodes. In the other bottle term that I'm going to use is you can't pour from an empty bottle. If you just burnt out, you can't, there's nothing to give. And once you get into medical school and you're needing to go in to placement, you're tired and you need to follow the doctor around and you're not really that interested in what they're doing, because let's face it, you probably won't be that interested in every single specialty. Some you'll love, some you might not. And unless you're one of those people who I wish I was. But it's not going to come if you don't have the mental reserve. And perspective is golden. Other people see things in a very different light to you. And if they can say, okay, I see how you feel about this. Why don't we try this? That is useful, because you might never have thought of that, because that's not how you work. But their perspective is golden. That's me. I'm stubborn. I did not do that. I still do not like doing that. That's 4-year-old me. I remember when that photo was taken. My mum said, if you don't stop making that face, I'm going to take a photo of you. I didn't stop making that face. Hence that photo. Yeah, I still make that face to this day. And my mum's like, you're making the face again? And I know I'm making it. So yeah, I'd made that face because that's in Legoland, and I didn't want to leave the waterworks. So yeah. Know your worth. Open it. This is just all aspects of life, but in particular, in open days, don't not go somewhere because you're like, oh, I can't do that. No. I didn't go to Cambridge and Oxford because I was like, no, I can't get into those. I also didn't want to go to those, but I was like, no, there's no way. And I didn't want to sit the BMAT because I was like, I'm not gonna. Why? No, there's no way I'd do well in that. Which wiped out a whole load of universities for me. Luckily, the ones that I actually ended up wanting to go to didn't have BMAT. Sorry, Zach, I don't know if Brighton Sussex has a BMAT. And then friendships as well, relationships. This got me a lot during medical school. They change a lot because you're in placements at different places, and don't let people mess you around, and you're just as important as they are. And your worth is just as big as theirs. And coursework as well. Like if you get a bad grade, what they think of you isn't what the whole world thinks of you. So if they say something like, oh, this looks like it could have been put more effort into, maybe, well, I'm like, well, I don't have a professorship in this, please. I don't understand quite what happened here, but it doesn't mean that that's your entire life is something that you should put more effort into. That took me a while to go over. I had that exact comment. Try not to twist things against you, because if you're anything like me, I would have said something exactly like, yes, I know my worth, and I'm not good enough for this being medical school. And what one of my CBT therapists told me to say, because I'm a chronic user of not good enough, is to sit and stop and consider, and do you really mean not ready yet? And that is perfectly okay. If you don't think you're ready yet for something, then maybe you're not. Failing exams, I was very good at that. And I failed my 4th year OSCE, which is the practical exam. And I was just like, oh, I'm just not good enough for this anymore. And one of the welfare people said, well, maybe you're just not ready. You weren't ready to sit it then. And that gave me a different type of perspective. I resat it, passed it. And that really helped. If you don't think you're quite ready for medical school, great, take a year out. Or there's graduate entry medicine. There's all these different options. Don't feel like you have to do it now. And there's also should have, could have. If you feel like, oh, I really should have done that piece of work today and not left it till tomorrow because I'm just, there's so much to do. you could just say, I could have done that piece of work today, but no, I'm going to do it tomorrow. It puts a different point of light on what is effectively the same sentence. All right. I've only got a couple more slides, don't worry. And now I can't move the slide thing. Oh no, maybe not. A bit more of CBT sort of element. I've effectively learned the CBT theory at this point in my life. Notice when you're using unhelpful thinking styles. So there's all or nothing thinking, which is I'm so good at this. If I'm not perfect, I have failed. Either I do it right or not at all. So that's my sort of, you can probably see how a lot of medical students come up with this one. We're perfectionists by nature, medical students. And so this is a lovely one for us, but it's not a good thinking style to have. And then there's mental filtering. So noticing our failures or negatives and not seeing our successes. So it's like when you just see bad things about yourself, but you don't see the good things. And that's also called disqualifying the positive. So that doesn't count. No, I'm just looking at the bad things right now. No, don't tell me about the good things. I just want to tell you about the bad things. So, and that is, I'm also really good at that. So yeah, treat myself as I treated others. So I'm an advocate for all things in terms of welfare and mental health. I still try to at work. I can get a bit passive aggressive when people say a little bit discriminatory things at work. Show myself compassion. I'm getting a little bit better at that now. And the big one is, would you, when your parents say, would you treat your best friend the way you're treating your sister? I don't know if that's just my parents, but would you treat them the way you treat yourself? The way you speak to yourself, the way you think after getting grades back? I think that's a really good thought to think about. And then I'm not going to read this out. Don't worry, it's not an English lesson. But there's this poem called What You Missed on the Day You're Absent on Fourth Grade by Brad Aaron Modlin. And it's one my GP has on her wall. And it's one that I love. And it's one that I knew it before my GP had it on her wall. I just noticed it recently. But the most important bit is what bit I've highlighted, which is I am is a complete sentence. And I think that's a really nice bit to end on, which is you are good enough, really, to do what you want. You just have to, if you're like me and you're a perfectionist, you're prone to thinking negatively about yourself, unhelpful thinking styles. If I made it through, so can you. It's a barrier, definitely, but you have to think about ways that you can break it by going through all these different ways to build yourself up and learn from it. And people say you'd be a better doctor if you know how mental health, mental well-being, mental illness affects you and will affect your patients. And I was like, no, I don't think it will. But actually, at the moment, I'm thinking sometimes the way that other doctors I've seen dismiss patients with presenting with mental illness, and just call them heart sink patients, ones that they feel will never get better, heart sinkers. I definitely think that there is some truth in that. Not that they're a heart sink patient, but that it gives you this one-up on being a more compassionate, better, more caring doctor because you know how it feels. And so I'm hoping that this gave you an insight into a few things to think about this particular barrier. There are a lot more barriers which I feel less qualified to speak about. Some of those did apply to me. As I said, I've worked in Nottingham's widening participation bit for 5 years now. That's a long time. And so I do have experience in them, but this is my area that I think is really important that people, especially in the current day, really realize is not uncommon. You are not going to be the only one sat in that lecture hall on the first day. If you do suffer from similar things as me, you are not going to be the only one. And it's not a bad thing to make others aware. Yeah. And I'd recommend finding this poem, looking at what it actually means. And it's a lovely poem. And I'm not going to go, I nearly did an English degree. I'm not going to go into all of that, but it's a good one. So yeah, that's me done. If you have any questions, please do feel free to share them. And yeah, that's me done.
Excellent. Well, thank you very much, Dr. Walker. That was fab, and a real insight, which is really, really nice. So if like Izzy said, we've got some more bits and pieces here. Do you want to just quickly talk through these?
No, it's just basically
we'll leave them up.
Signposting.
Yeah, it's nice. It's nice to have these resources out there as well. And we do have a question here. I'm not sure of the answer to this. I'm not sure if you are. Izzy, if you're not, that's fine. Is it true that medical institutions have the right to revoke medical license if you have received mental health treatment, as they now regard you as incapable to work in a healthcare setting? I'm not sure of the answer to that. I'm not sure if you are. I
am aware of the answer to this one.
Okay, right. Brilliant.
And yes, it is. But it's very rare because most doctors have received mental health treatment, and there are definitely still doctors. However, we have what is called occupational health, which are a service which most people are terrified of. I was completely terrified of them until I realized what they're actually for. So occupational health are a service who assess your fitness to work, and they give you your vaccines, they give you blood tests for your vaccines, they give you and they assess you if you've got a long-term medical condition. And so what they will also do is, if they believe that you pose a danger to yourself or patients, they will inform the people that they need to know. And then you'll go through what's called a fitness to practice committee. And they have the power to revoke your medical license. This is rare. Like, I know people who have been in inpatient psychiatric treatment and have gone back to work. This tends to be for people who do not have insight, as in they don't understand that their condition is making them ill, or they have already caused harm. So things like that. For instance, fitness to practice is like the 3 words that terrify medical students, and why this is exactly why mental health conditions don't get declared, because people say, oh, I'll just get called up in fitness to practice and I'll get kicked out of medical school. Not true. You're more likely to get a professionalism issue like that if you don't declare anything, because they think, interesting, they didn't declare that. Do they not have insight? And do they not realize that this is something that needs to be talked about with occupational health? So it is true, it does happen, but in the rarest, I don't know anyone who it's happened to. And you can you can quote me on that one. I mean, I've received mental health treatment since my entire time at medical school. The GMC are aware. GMC is our medical licensing body. I had to declare when I was applying for my license, I had to tell them, oh, by the way, I have this condition, this condition, this condition. This is how it affects me. Here's the medical evidence. Can I have my license now, please? And they were like, sure, here you go. Thanks for telling us. And that was that. So, yeah, really, if that's something you're worried about, you can look up GMC's fitness to practice guidelines, and you'll see that it is so rare.
I was wondering if you're able to choose a specialty or select rotations in foundation years that may make managing your anxiety easier. Specifically, I was wondering why you chose emergency/acute medicine, which sounds more stressful than other areas, more downstream. So yeah, we'll finish on that question. I think that sounds like a good one to finish on, very pertinent to you.
Yeah. So in foundation years, we rank what we want to do. In order for my deanery, there are 300 jobs. So rank from 1 to 300, which took a while. And because they knew that I had this situation going on, I was also able to talk to my program director beforehand and just make her aware, like, by the way, this is something going on. I'm actually less than full time, so I'm part time. So I will do a 7th rotation as well as my normal 6. And so I, for the bottom 150 ranked specialties, all of the ones are psychiatry, right down the bottom, because they're either psychiatry or GP. You've got half and half. I like GP, really don't want to do psychiatry. They all went down. I am kind of interested in emergency medicine, ICU, anesthetics, and pediatrics. Pediatric emergency medicine would be amazing. So emergency medicine kind of found its way up. And also because I've got some other pretty cool jobs in this specialty. I've got obs and gynae, geriatrics. I love it. And GP. And because for me, location. They are all in the same hospital, which is 2 miles away from my house. I don't have to move. So that was excellent for me. And it made being part-time easier because it's all within the same trust. And otherwise you might end up having to move. My deanery is huge, so 90 miles away. And that's just not good for people like me. So that is why I ended up with that. So yeah.
Excellent. Thank you very much, Dr. Walker. And thank you again for your talk this evening. It's been really insightful and great to hear about your experiences. And hopefully it's been really helpful for our attendees as well. Thank you very much for coming along this evening. You can now head on out. We hope that you enjoy the rest of your evenings and hopefully see you at another lecture next month or the month after or whenever you want to come back. Thanks very much, folks.